My name is Philip Akelola. I've been ailing for a while. It started around 2-3 weeks ago when I had a blood bacteria. I got treated. It took around 3-4 days. Then a day or two later, I was feeling unwell again. Then it was around midnight when I told my mother, I think we need to go to the hospital.
It was very late at night. He had signaled to me that he's not feeling very well, and we took off. So we reached the hospital. Of course, they went to the triad, the emergency area. They did investigation, and finally we were admitted. His status was changing every minute. He was very sick. Temperatures high. He was not breathing normally. So when the doctor came, he was admitted straight away to HDU. We spent a whole week in HDU. They started him on hemodialysis. So there we are, hemodialysis. The parameters came down, others didn't come down, they kept on trying. But it reached a place. Now the doctor said, okay, we discharge you to the ward. But they recommended that we must look for a nephrologist urgently.
This is Dr. Julia Sokel. I'm a consultant physician and nephrologist based at Aga Khan, an affiliate. We are bringing to you the story of one of our patients we've had recently, Mr. Philip. Philip, immediately a gentleman was referred to us from Bungoma with severe renal failure due to malaria, P. falciparum. He was referred to us after having spent about 10 days in that hospital. The reason for referral was he was actually deteriorating despite frequent dialysis and the treatment that they had started him on. So we did accept to receive the patient and activated our emergency response team, and was received by the emergency room physician and the nurses in the night about 1 a.m. and appropriate investigations were carried out.
So Philip was started hemodialysis again. The doctor was managing. The results came, he had started. The electrolytes had started coming down. We continued in HDU, and for me it's a miracle. The doctor came, looked at him and said he's doing well. And after a few days we were transferred to the ward.
The initial test actually showed that his kidney function was quite low, less than 2%, with a creatinine of above 1,200. He also had the regimen of electrolytes with hyponatremia, hyperkalemia, and metabolic acidosis, which was moderate.
For the kidney function test, as we can say, we realized that this our patient was having a creatinine of above 1,000. The normal that we can give is 53 to 124. So that one is much higher. This indicates that the kidneys were not functioning well. And again, as we can talk of the GFR, estimated glomerular filtration rate, we realized that our patient was having a GFR of 2, but the normal ranges comes from 100 to 125. That one also shows that our patient kidney were not functioning well.
His pH was 7.25. Because of the severity of his illness, he was admitted in the ICU on oxygen because oxygen would drop about 87% on room air. We did also find out that from his lab test he had severe sepsis. His white cell count was high, as well as elevated CRP, which are markers of infection. So we started him on appropriate antibiotics and also restarted his antimalarial treatment. And upon reviewing his kidney, we found that despite the renal replacement therapy, that is dialysis that he was getting, he was kept very dry and dehydrated, and this prevented kidney recovery. So we did manage his fluids appropriately by allowing him to get more fluids back. We did appropriate dialysis, something called SLED, that is low efficient dialysis, because his blood pressure was borderline low. The first session was done the next day with a 1 unit blood transfusion, which corrected his hemoglobin from about 8 to 10. He had a successful dialysis session of about 4 hours with a standard prescription of about 400 ml per hour. And he was really improved by the next day.
Yeah, I was excited because I know nothing just happens like that, but God was using us. He was giving them wisdom. He was giving them the spirit of excellence to find out what to do about my son. And in Aga Khan, the staff were very friendly, they were friendly, they were caring, and everything they were doing encouraged me as the mother, because I was here throughout as the caregiver also. As the doctor comes for the ward round, each day he was getting better.
We did notice that by 24 hours his urine output picked up, his blood pressure was quite improved, and it actually started mobilizing within 24 hours. The antimalarials were actually stopped at 24 hours because we actually managed to check his blood slide, and which turned negative. So from the second day of admission, we noted a progressive improvement. His urine output peaked from initial less than 5 ml per kg to almost 10-15 ml per kg. And by 48 hours, he made almost 2.5 liters of urine in 24 hours. And his AKI, or kidney recovery, continued in the third day. In fact, after doing the initial session of hemodialysis, his kidney recovered such that by the fourth session of dialysis, the fourth session of hospital stay, his kidney function had moved from initial 2% to 50%.
And today, as I speak, you can see him. He has spoken. Philip is healed. Philip is okay. For me, it's a miracle. It's a big miracle. I thank the staff here who have worked tirelessly day and night to take care of my son, and I don't want to take it for granted, because I know the God I serve has done it, because through him he has given wisdom to the staff, especially the doctor over here, who has been working with his colleagues here, and they have turned around